Yo, I'm a physical therapist and I need to say this about physical therapy because it's getting bad. So, if you're going to physical therapy for any pain you have when you work out, when you lift weights, and you notice that every single person in that clinic, in that room, is doing the same exercises, you need to get a new PT ASAP. I don't care if it's back pain, knee pain, shoulder pain, you're post surgical, and you're in therapy, if you are in that room and you notice every single person is going through the same exact routine, the same warm up, the same band exercises, the same dead bugs, bird dogs, that's a problem. And don't get me wrong, these exercises are good. There's a time and place for them. I use them in certain cases, but it has to be personalized to what you need. Everybody in there cannot be doing the same exact thing because the reality is everybody is in physical therapy for different things. And you should be seeing that reflected in your care. Because let's be real, you may be going to PT because you're having pain when you squat 225, right? You have knee pain when you squat 225. Somebody else might be having pain when they just go up and down the stairs. And those are two different things, and those are going to require two different forms of rehab, two different rehab plans. And also, if you take those two people and you ask them what their goals are, what their training history is like, what their medical history is like, all of those things are going to be different. So you have to make sure that your plan represents that. And if you're on this page, if you follow me on Facebook, on Instagram, if you're watching this on Facebook or Instagram, you're following me because you care about your training. You take your training seriously. You're trying to get back to going hard in the gym. Maybe you want to squat heavy, you want to lunge heavy, you want to be doing heavy bulking, split squats, deadlifting. You want to get back to doing these things without worrying about if you're going to flare up a certain part of your body, right? So when you go to therapy and you notice everybody's doing the same exercises, that means you're getting put into a template. Like there's no personalization to your care. You're just getting put into a template, and now you're doing the same exercises as somebody who just had surgery 2 weeks ago and can't even use their quad. Meanwhile, yesterday you was in the gym squatting 225 for 5 reps, right? Now you're in the clinic with people who don't even lift, never touched the barbell a day in their life. You're working out with people or doing rehab with people who just want to be able to get out of bed without their back aching or go up and down the stairs without their knee aching. And now you're sitting there thinking, how is all of this going to get me back to doing what I want to do? And the harsh truth is, it's not. Your PT may not tell you that, but I'm going to tell you that it's not going to get you back. So, what you need to really do is make sure that your therapy sessions look like what you want to get back to, because the more disconnected it is, the more unfamiliar or unsimilar, I don't even know if that's a word, but the more different your rehab looks from what you want to get back to, the less likely it is that you're going to get back to whatever you want to do without pain. So let's say, for example, your knee hurts when you squat 225. I guess that's the number today. Let's say your knee hurts when you squat 225 and you go to PT and you're not doing any type of squat variations. You're just doing leg raises, your little hip abduction leg raises. You're doing band walks. You're doing leg raises. You're doing glute bridges. And you're thinking, like, in my workout 2 days ago, I just RDL'd however much weight. I just did 350 on the hip thrust machine, and now I'm in here doing these baby ass exercises. So you ask your therapist, when are we getting back to squatting? And they don't necessarily have an answer. They're like, oh, just hold off on that. That's a red flag, because the reality is, if you have a heartbeat and if you got up from your chair this morning, if you went to the bathroom, got up from the toilet, there is a squat variation that you can do. You just need to find that squat variation and progress it within a way that your knee can tolerate. So that may look like a box squat, right? Sometimes you're able to squat without pain, but it hurts when you get to a certain depth. So that's when box squats become very helpful. You may be able to do a squat at a certain tempo. So instead of saying, hey, I'm just not going to have you squat, your therapist should be giving you squat movements that you can actually train and go hard with. not just saying, oh, we'll go back to it later. Because at the end of the day, at some point, you do have to start reintroducing those squat movements. There's no way around it. And usually they tell you not to do that because they don't have a plan for you going forward. They don't know how to reverse engineer. Hey, this person wants to be able to squat this weight. How do we build up to that? So that's a red flag. You need a PT if you need a new PT if you're noticing that happening. If anybody, any of my clients, any of my patients ask me, when can I do XYZ? I can outline exactly when they can do it. You need to be able to do this, this, and this before we progress to that. If you're not getting those answers, then you need a new PT. And now I'm not saying just because you're not squatting right now in your therapy sessions that you automatically need to just leave. But what I am saying is you need to ask those questions and you need to be able to get an actual answer, because any professional who is good at what they do should be able to give you these answers. They might not be able to tell you how much time it's going to take, because everything is not based on time. Sometimes you have to show physical readiness in order to do something. For example, a good example is, say you just had ACL reconstruction. Technically, it is safe for you to run at 16 weeks. But if you can't do a single leg squat, if you can't control the knee over toe position, if you're still having difficulty doing certain loaded movements, then you're not ready to run, no matter how far out you are from surgery, right? So there should be a criteria based approach to your treatment. If you're noticing that somebody cannot give you those answers, that's a red flag. You need to get a new PT. Next, let's say you have knee surgery, because we're on knee surgery. Let's say you had a meniscus repair or a meniscectomy where they just trimmed out the tear, and you should be good to go in like six to 10 weeks. And early on, you're doing the quad sets, the hill slides, you're doing leg raises. That's fine early on. Those need to be done early on. But when you get to that 10-week mark, if you're doing the same exercises you were doing when you were 2, 3, 4 weeks out of surgery, that's a red flag. And you need to first ask the question of, how is this supposed to get me back to my goal? And then see what they say. And then if not, you need to start to look for somebody who can help you do that, because there's nothing wrong with taking this approach and asking these questions about your care, because like I said, when you care about training and doing certain things, you need to be able to safely progress through those things. And it's not your job as the patient, especially if you don't have a background in rehab or this is not your wheelhouse, you shouldn't be trying to figure these things out by yourself. So if you're noticing you're doing the same exercises at the 8-week mark as you did on the second week, and you're still not initiating squats and step ups and single leg work, you're not going to get back to doing the things you want to do. So make sure you ask the question. I'm rambling now, but the way I like to explain all of this is, a lot of people say, oh, I had a ACL reconstruction, I had a meniscus tear, I had a few lumbar fusion, I had a rotator cuff repair, and I did 8, 12 weeks, whatever, however long of therapy, and it didn't work. And when you ask what they did during therapy, it's not that it didn't work, it's just that you weren't doing things that were setting you up for success from the beginning. So obviously it didn't work. It's kind of like, say you want to learn Spanish, right? Your main language is English. You say you want to learn Spanish, so you hire a tutor, right? You go to this tutor for 3 months, and the whole time you're speaking every language but Spanish. You speaking English, the most you're doing sign language. Yeah, you're attending the tutoring sessions, you're showing up, you're consistent, you're doing the work, but none of what you're doing translates to your end goal of becoming fluent in Spanish, which is what you hired a tutor for in the first place. So this is what I mean by, you can attend all these therapy sessions, you can do all the therapy your insurance improves, your doctor approves, your doctor recommends, and still not get to your end goal. And that does not mean that therapy doesn't work. It just means that you didn't have therapy that was supposed to work from the beginning. So like I said earlier, the more different your rehab looks from your actual training or whatever you want to get back to, the less likely you're going to get back to it. So if you're in physical therapy right now, I need you to ask yourself, can you see yourself getting better and getting back to your lifting routine with what you're currently doing? And if you are somebody who is in physical therapy right now and you just had surgery, you may not be doing any like weight bearing things. You may not be doing anything that resembles lifting. But if that's your situation now, as you progress through rehab, I need you to keep that question in the back of your mind, because if you cannot connect the dots and see how what you're doing is going to translate to what you want to get back to, I don't want you to make any assumptions, because sometimes people don't understand that early on you need to be doing some of these basic things. But I do want you to ask your physical therapist or whoever you're working with, how is this going to get me back to whatever your goal is? And what is the actual steps? For example, if you want to run, say, hey, my end goal is to be able to run a 5K, 10K. My end goal is to be able to do a high rocks. What do I have to be able to do in order to do that without hurting myself again? Like, what are the steps? And they should be able to outline that for you. If you don't have a good answer to that question, you need to get a new PT. I'm not saying this for any of my benefit. I just want everybody to get good care, get good rehab, and actually get back to the things that they want to get back to, because a lot of times people are getting hurt, they're having pain, and they get discouraged and feel like it's the end of the world, it's the end of their time being athletic. And that's literally not true. You just need the right guidance. So if you've been in PT and you can't see how what you're doing is ever going to get you back to what you want to do without pain, without hurting yourself, without flaring up, then you need to be inside my lifters rehab training program and not wasting your time in a generic clinic where you're put into a system, where you're put into a template, and you're getting the same exercises as everybody else. If you want the details to that program, comment rehab and I'll send you the details. If you have any questions, just message me. You can also message me the word rehab and I'll automatically send it to you. But with that being said, I hope you guys have a great Sunday and train hard. Get ready to train hard during this week. And I'll talk to you guys later. Peace.